Okay, we're recording right now.
Okay, mine is too.
Okay, we're ready. Good evening, ladies. I'm very happy to be here this evening. Such a lovely audience here at this wonderful campus. And I'd like to talk to you tonight about a phenomenon that has affected me over the years and affected many other people in the United States. And more significantly, physicians tell me in this area quite a few other people are affected as well. And that topic is kidney stones. Have you ever heard of kidney stones or known someone who's had them? Well, they can be extremely painful. And I brought a picture to show you. That's two typical stones, and those are they're very jagged, they're very rough. Anyway, my first encounter with kidney stones was in the late 80s. I went to work one morning, and as I'm at work enjoying my morning, I began to feel a pain that I've not felt before. And it was something that the longer I thought about it, the more it hurt. I thought, well, this is not right, because it's something I didn't recognize. So I went to the emergency room and saw the doctor. And after some x-rays, the doctor announced that I had a very large kidney stone. So some of the pain associated with kidney stones is a flank pain, very intense pain. Some pain radiates from the back around. Your kidneys are high in your back, and that pain radiates to the front. Some people have abdominal cramps, some don't. I didn't have that, but everything else I had. If you've ever seen a faucet that has water, whitish stains around the tip of it which drip, I always thought that that's how the kidney stone was formed. That's not quite true. They can form in a matter of minutes. And I only learned that with the last stones that I had. Several types of stones. There are calcium stones, which are probably the most common. The second stone I can think of might be uric acid stone. Uric acid stones are associated with people who have gout or have very high protein diets, where concentration of urine can cause these stones. The calcium, of course, mostly comes from food. Many of the foods we eat are very high calcium. Vegetables even, like broccoli, soybeans, extremely high in calcium. I was using soy milk thinking that I was doing myself better. Turns out I wasn't, still high calcium. Anyway, another stone is called a crystalline stone, which is much harder to treat. But the only thing you can do is drink a lot of water and hope that you can get it out. No definite cause of why stones occur in some people and not others. There's no link that's been associated yet with either. The current thought is that if you simply don't drink enough water, you're very likely to have stones. And in the United States, 12% of men, 7% of women will have stones within their lifetime. Last year, something like 1.2 million people had kidney stones and presented to physicians for treatment. Dietary and heredity factors. In my case, there were heredity factors. My father had kidney stones. My youngest son has had kidney stones. The dietary aspect, excuse me. The thing is, because we always eat the same foods. Your house might be a meat and potatoes house or a vegetable and fish house. You tend to eat what your parents eat, what your grandparents eat. And so that the dietary aspect environmentally could come from that direction. The symptoms of kidney stones are kind of a multitude of things. Some people have said that their pain is very minimal. Other people have said that women have said compared to having babies or broken arms, it's much worse. They'd rather have another child than another kidney stone. I don't know what it's like to have a child, but I do what it's like to have a kidney stone. It's very, very painful. Some people have reported that they get really low back pain. The back just aches and aches and aches like they've been doing lots of work. Some people have nausea and vomiting. Some people simply have nothing. until they see the stone appear when they void. I've experienced basically all of the symptoms except for the nausea and vomiting. I have hurt, and when you have the attack, which there's no forewarned signs, you simply have it. The minute you get to the doctor and they give you medication, the pain goes away, and the episode is over. So it's really a sneaky phenomenon. Treatment, there are several treatments. I've had most of the treatments. Initially, when I went to the doctor with my stone, they tried to retrieve the stone with a ureteroscope, which is a scope that enters through the urethra, goes through the bladder up into the ureters, and they simply try to grab it. Well, that didn't work. And the ureters are very soft and very pliable, and they're very easy to destroy, so you can't get really rough. You would think that we can just grab it would be really easy, but it's not. So, after about 4 months of trying different things, I went to the Oklahoma Lithotripsy Center, located in the Deaconess Hospital in Oklahoma City at that time. The initial lithotripters were large tanks of water, and the patient would be lowered into the water. On either side, there was a cylinder that produced a shock wave into the water, and they would line the beams up with a scope on the stone itself, and they would start it. They would bang, 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 and as these sound waves went through, they'd break it up. Well, I recall lying in the water thinking, I wonder why everyone has on ear protection but me. But I was out anyway, so no big deal. But that took, at that time, about an hour and a half. I think there were 700 firings from both of the machines. Since that time, the lithotripters have become quite portable. In Kansas, for example, when physicians have several patients who get presented with stones, and they've decided that is the aspect to go to, a lithotripter comes, I believe, maybe from Pratt. When they come, it's in a van, they wheel it in, bring it into the surgery room. The patient's put out, and the machine simply rolled over and adjusted. An hour later, you're back in the room, the stone is busted, and hopefully you can void the stone later that day. So thinking about concluding this presentation for you, due to the fact that you don't know that you have kidney stones, you could have a kidney stone at any time. Drink lots and lots of water. It's recommended that for women, 2.2 liters a day. For men, 3 liters a day. And that's the basic recommendation. If you can drink more successfully, you should. Because the more you drink, the more diluted the urine is. Therefore, the solids can't stick together, and they don't participate out and form the larger stones. But until you have the attack, you don't know. There's no pre-warning, no anything other than maybe a disposition that your family may have had stones, and that you could. The initial surgeries were from midline to the middle of the back to open the patient up to get to the kidneys. They're retroperitoneal, which means they're located up in the body cavity. And so it was a horrific surgery. So today we have a very good deal. Now, should you have stones, that's certainly the way to go. But prevent the stones, drink lots and lots of water. If you're an athlete, drink lots of water. If you're not, drink lots of water. Either way. Any questions that you'd like to get answered for you? Well, thank you very, very much. Have a good evening. All right.